Okay, so in this assessment, we're looking a bit more closely at the lengthening capacity of the posterior lateral glute. Now this is what we would use as an exercise as well, but I really like this as an assessment too, to really kind of bring the client's awareness to the limitations between left and right, because it also allows us to get a clear insight into how that glute is lengthening via a lateral translation of the pelvis. Okay, so we're going to show you from the side here first. So the goal here is to see, okay, how well this glute can lengthen on the left-hand side. So what we're going to do here is we're going to kick that right leg behind us, Connor. And if you kind of come forward just a touch so you have a bit more range in the back there. So we're going to kick that leg back. And what we're going to do here is, because we're getting length into the posterior part of the glute and the lateral part, what we want to try and do is expose the lateral part of the hip here. The way we do that is by externally rotating this left hip. I have clients kind of bring it to the point where the heel is underneath the knee. This leg straightens out behind. The target femur externally rotates. And what happens there is that when that femur externally rotates, the greater trochanter will drop down and allow you to get more length into the lateral portion of the hip here. Now, we have that femur, that hip at around, maybe a little bit beyond 90 degrees of flexion there. That's okay, you can start at 90 degrees if you want. But the key thing here now is I want to see how well the client can translate the pelvis laterally. And we'll show you what that looks like from the rear view as well. But the cue I give clients is, okay, widen out your hands, Connor, just so you have a bit more stability. And I want you to keep the pelvis facing the ground, but I want you to think about pushing that left hip or your left pocket towards the left and see how much range the client has as they shift to the left, because that will expose that length. And oftentimes clients will feel a strong lengthening, stretching sensation. And we'll see how that looks left versus right. So we'll have you spin around the corner with your head facing this way, just so you can see it from the back. And you'll see the difference between left and right here. So when we're checking the left side, right leg kicks back behind, the target side externally rotates, and we'll widen out the hands, because if that left hand was closed in, as you shift, you're going to feel like you're going to fall over. Generally for me, I actually don't want the hips to go on their own. I actually want the pelvis and the trunk to go to the side corner. So I want you to shift everything to the side. What we're looking for here is, can that pelvis remain squared? We don't want to see a rotation like this, because then that reduces the lengthening demand. We want to see, can that pelvis shift? We're assessing for where you feel that restriction. You feel that restriction there, Connor?
Yeah, left hip.
Left hip, okay, kind of posterior lateral glute kind of area here, yeah. And then we're looking at that relative to the other side. Okay, so Connor, if you switch sides there, so right knee down, left leg back, little rotation in, heel underneath the knee, and then we're kind of shifting that pelvis to the right here. And you'll see straight away, see that left pelvic lift here. So Connor's struggling to keep that pelvis square. So if we were to be really honest with it, we want to keep that here. And then if you shift towards me, Connor, that's your limitation there. So here you're seeing a clear limitation in that lengthening through the right glute here, which we saw during the standing toe touch. But here it just allows us, you can come back there, Connor. Here it just allows us to kind of really see, okay, in an isolated manner. So we're clear in what we're gathering, the information we're gathering. We're clear in what's limited, what is within normal limits, what's painful, what's non-painful. We're asking kind of, where did you feel that? Did you feel that in the anterior hip, posterior hip, more of a pinching sensation in the front? So again, it tells us that we may need to go after trying to get length into these tissues. But the way that we do that then, this is the key thing, the way we go about trying to get length through here will require flexibility in our approach, a combination of local strategies, coordinated strategies. We're not just going to force Connor into this position if he's feeling some pinching in the front. We'll have to do other strategies here as well. But this gives us clear insight into, okay, that right hip is struggling to the right glutes, the posterior lateral glute on this right hand side is struggling to lengthen. And what I find also really helpful here is for the client to feel that as well. You can really feel, okay, I can get that left hip to translate much better to the left. I can feel the range I have there. On this side, there's a significant limitation there. That's why I like it, because it gives you the ability to explore this translation left and right, which is really important when we're getting that length, or when we're assessing, but also when we're trying to promote that length into the posterior lateral glute. Okay, so this is your quadruped assessment, but like I said, you can also use this as a way to load the glutes in a lengthened position as well.